In our intensive care unit we see a number of patients with bad infections with influenza, particularly in the winter months. And they come in often because they need support with a breathing machine because they've developed pneumonia, severe pneumonia. Most commonly we see it in patients with problems with their immune system. So these are patients such as diabetics, patients on steroids, patients that are pregnant and patients that are obese, and they're the ones that are more likely to develop the severer forms of influenza. You would only get onto intensive care usually because you're having trouble breathing and you're unable to get enough oxygen into the body. So we would see patients with chest x-rays that look a bit like this, where the normal lungs are black because they're got air in them, and this one has got infection in all parts of the lungs, and when you get to that stage you'll be gasping for breath and going blue. So at that stage the patients get resuscitated and put onto breathing machines, and they come here for management of that. That's often complicated by failures of other organ systems such as kidney failure and low blood pressure. So although most of the patients that arrive with that sort of problem will survive, a certain proportion of them, about a quarter or a third, will succumb from that disease. Yeah, we'll see several deaths every year from influenza-related illness, and more than that when there's a significant epidemic. Patients in those high-risk categories and the people that live with those patients are strongly advised by everyone, including me, to get immunised, because the vaccine is very safe and it is usually very effective. I have it personally, and I encourage all the staff in the ITU to have it, because obviously we're exposed to a lot of germs and we're in a position where we can spread it around the vulnerable groups. So it's very important for healthcare workers to get immunised.